welcome to the Deep Dive. Today we're diving into a fascinating case study about a Yorkshire Terrier
Oh, yeah.
with not one, but TWO hydrated nucleus pulposus extrusions,
Wow.
or HNPEs in his cervical spine.
It's certainly not something you see every day.
No, not at all.
Okay.
So to set the stage for our listeners, we're talking about a 9-year-old, 6-kilogram male Yorkshire Terrier who was brought to the emergency vet because he couldn't stand.
Right. And that's where it gets really interesting. You see, HNPE is kind of like a slipped disc, but instead of the disc material being hard and calcified, it's more gelatinous.
Yep.
And as the name suggests, hydrated.
Hydrated, I see.
And this can cause a different kind of spinal cord compression than you would see with a typical calcified disc.
Interesting. So let's talk about this little guy's initial exams.
Sure.
What were the vets seeing?
Well, the exam revealed non-ambulatory tetraparesis, meaning he couldn't walk, and all 4 limbs were infected. He also had proprioceptive deficits, basically. He didn't know where his limbs were in space, and decreased flexor reflexes in his forelimbs.
I see. And did they notice any pain?
Yes. He was experiencing mild neck pain,
Okay.
which is a pretty common finding in these cases.
So what happened next? How did they figure out what was going on?
Well, the diagnostic journey started with the usual suspects, blood work and x-rays.
Right.
But those came back normal. So that's when they decided to do an MRI
The MRI.
of the cervical spine. And that's where they discovered the double trouble. 2 HNPEs,
2.
one at the C3-C4 vertebrae,
Yep.
and another at C4-C5.
And the case report includes some really detailed MRI images, figures 1, 2, and 3,
Yeah,
that show exactly what was going on.
they do.
Could you walk us through those?
Absolutely. Figure 1 gives you a good overall view of both HNPEs.
Okay.
The extruded disc material appears hyper-intense
All right, intense.
on the T2-weighted images, which is typical for this condition.
Okay.
And you can see how those extrusions are causing significant spinal cord compression.
Yeah, you can really see it in the image.
You can.
What about figure 2?
Figure 2 shows the difference in signal intensity before and after contrast was used.
Right.
So in figure 2A, the pre-contrast image, you can see the HNPEs as hypointense areas.
Hypointense, okay.
But then in figure 2B, after the contrast, those areas become hyperintense,
Oh, I see.
meaning the extruded material is enhancing.
So it's like it's lighting up.
Exactly.
Okay.
And that's a key diagnostic feature for HNPE.
So they're seeing the HNPEs themselves.
Right.
But was there any evidence of actual spinal cord damage?
That's where figure 3 comes in.
Okay.
It focuses on an intramedullary lesion at the C4-C5 level.
Right.
This lesion is hyperintense on T2-weighted images and doesn't enhance with contrast, which suggests edema or gliosis.
Gliosis. So basically, scarring.
Basically, yeah, scarring within the spinal cord itself.
Wow.
This shows us that the compression from those HNPEs was actually causing damage to the spinal cord.
So this little Yorkie is dealing with 2 HNPEs and evidence of spinal cord damage.
He is.
I'm guessing surgery was the next step, right?
Well, you might think so, but here's where this case takes a surprising turn.
Oh.
Despite the severity of the findings, the vets decided to try conservative treatment first.
Really? I have to admit, when I first read this, I was surprised they didn't go straight to surgery.
Yeah.
Why the conservative approach?
Well, it was a calculated decision based on a few key factors.
Okay.
Firstly, while the spinal cord compression was significant, it wasn't considered severe enough to warrant immediate surgery.
I see.
Secondly, the dog wasn't showing any signs of respiratory distress, which is a critical factor in these cases.
So they decided to hold off on surgery.
Right.
What did this conservative treatment involve?
Well, the treatment plan had several components.
Okay.
They started with meloxicam,
Meloxicam.
which is an anti-inflammatory and pain reliever.
Of course.
They also prescribed strict rest for a full 4 weeks.
Strict rest. Got it.
But the real star of the show was intensive physiotherapy.
Okay, let's talk about that physiotherapy regimen.
For sure.
It sounds like it played a crucial role in this dog's recovery.
Absolutely. The physiotherapy program was incredibly thorough,
I can imagine.
addressing multiple aspects of the dog's rehabilitation.
Like what?
It included things like kneading massage, laser therapy, passive range of motion exercises, underwater treadmill therapy,
Wow.
a proprioceptive platform, and even obstacle courses.
Wow, that's quite a comprehensive program.
It was.
With so many different techniques.
Well, each technique targets specific aspects of recovery.
Okay.
For example, the kneading massage using the petrissage technique
Dressage technique.
helps improve blood flow and relax muscles.
Right.
Laser therapy applied to the cervical region is thought to reduce inflammation and pain.
Interesting.
And the passive range of motion exercises are crucial for maintaining joint mobility, especially during that initial period of rest.
I understand those.
Yeah.
But what about some of the other techniques, like the underwater treadmill?
Yeah.
I've heard about that, but I don't fully understand how it works.
Underwater treadmill therapy is fantastic for building strength and coordination in a low-impact environment.
Okay.
The buoyancy of the water takes pressure off the joints, allowing for resistance training without putting excessive stress on the spine.
Huh.
They started slowly, at about 2 kilometers per hour, with the water level at the dog's greater trochanter, gradually increasing the duration and intensity over time.
So it's like a gentle way to get him moving again.
Exactly.
And what about those proprioceptive platforms and obstacle courses?
Right.
Those sound pretty advanced.
They are. Those techniques are all about retraining the nervous system, helping the dog regain balance, coordination, and body awareness.
So basically reteaching the brain how to communicate with the muscles.
Pretty much, yeah.
That's fascinating. It sounds like they really threw everything they had at this case to help this little guy recover.
They did.
And what was the outcome of all this?
The outcome was nothing short of remarkable.
Really?
After 4 weeks of this intensive therapy, the Yorkie made a complete recovery.
A complete recovery. Wow.
And get this, a follow-up 7 months later showed that he was still doing great.
No kidding.
With no signs of his previous problems.
That's incredible.
It is.
You don't see that kind of turnaround every day, especially with 2 HNPEs and evidence of spinal cord damage.
Right.
This case really challenges some common assumptions about HNPE, doesn't it?
It definitely does. It highlights the potential for conservative management to be successful, even in complex cases with multiple lesions.
But this is just one case, right? Are there other studies that support this idea of conservative management for HNPE?
Yes, there are.
Okay.
This case report adds to a growing body of evidence suggesting that conservative treatment can be just as effective as surgery for some dogs with HNPE. There was a study published in 2018 by Nestler and colleagues that found no significant difference in outcomes between dogs treated surgically and those managed conservatively.
Interesting. So it's not just a fluke with this one Yorkie.
Right.
Are there any other studies that specifically looked at cervical HNPE, like in this case?
Absolutely. Borlas and colleagues published a study in Veterinary Record in 2017 that looked specifically at cervical HNPE and found similar results, with conservative management proving just as effective as surgery in many cases.
So it seems like the decision to pursue surgery or conservative management shouldn't be based solely on the presence of HNPE or even the number of lesions.
Exactly.
What factors should vets be considering?
You're absolutely right. It's not a one-size-fits-all situation.
Right.
Vets need to take an individualized approach, considering things like the severity of the neurological deficits, the degree of spinal cord compression, whether there's any respiratory compromise, and of course the owner's preferences and resources.
That makes a lot of sense. So this case, along with other research, is suggesting that conservative management can be a viable option for HNPE.
It is.
But this specific case is still pretty unique, right?
It is, yeah.
It's not every day you see a dog with 2 cervical HNPEs recover so well with conservative treatment. What are the broader implications of this finding?
Yeah, it really is. When you think about it, this case pushes the boundaries of what we thought we knew about HNPE in dogs.
It really does. It opens up a whole new avenue of thinking about how we approach these cases.
Right.
So for our listeners who might be veterinary neurologists or just really interested in this topic,
Sure.
what are some key takeaways from this case? What should we be thinking about?
Well, first and foremost, it reinforces the importance of considering HNPE as a possible diagnosis in dogs who suddenly develop neurological problems, even if they don't have a history of back issues.
So it's not always the classic disc herniation we learn about in vet school.
Exactly. And secondly, this case underscores how important MRI is for getting an accurate diagnosis.
Makes sense.
X-rays might not show these lesions at all.
You need the right tools to see what's really going on.
Exactly. And lastly, this case highlights the potential for conservative management to be successful in treating HNPE, even when there are multiple lesions and evidence of spinal cord damage.
Right. It challenges the assumption that surgery is always the best or only option.
It does.
But, as we discussed earlier, more research is needed to figure out which cases are most suitable for conservative management and which might benefit more from surgery.
Absolutely. There's still a lot we don't know about HNPE, especially these more unusual presentations.
So this brings us to the burning question, doesn't it?
It does. Does the presence of multiple HNPEs, like in this case, ultimately affect the long-term prognosis compared to single lesions?
Right.
We need more research to answer that.
And how do these findings apply to other breeds? We know this case involved a Yorkshire Terrier.
Right.
But could the same principles apply to larger breed dogs?
Yeah.
Who are also prone to intervertebral disc disease?
These are all important questions that need further investigation.
This case report has certainly opened up a whole new area of exploration in canine spinal disease.
It has.
It's a great reminder that we're always learning, and there's always more to discover about these fascinating conditions.
Absolutely.
Well, I think this has been an incredibly insightful deep dive into a truly remarkable case.
It has been.
It's amazing to see the potential for conservative management to make such a difference in a dog's life.
It really is. It highlights the importance of a comprehensive and individualized approach to treating these complex cases.
Thank you for sharing your expertise with us today.
My pleasure.
It's been a pleasure exploring this topic with you.
It's been great talking with you.
And for you listening, we hope this deep dive has sparked your curiosity and given you new insights into the world of veterinary neurology. From Vet Neuro Jar, keep those minds inspired, hearts light, and tails wagging.